Hello, and welcome to this video on sulfur allergies. Sulfur allergies are a concern in home brewing and more generally in food. Sulfur is a very common and long-used preservative. Romans used it and is used today, especially in winemaking. The amount of sulfur in foods is limited by regulation in the UK, USA, and most other developed countries. Sulfites reduce the bacterial growth, retain colour, and reduce spoilage. This is done by releasing sulfur dioxide. This is a highly reactive species. Sulfur-based compounds are listed as sulfur, sulfite, sulfate, and sulfonamide. Home brewers might know it as metabisulphites. As with most highly reactive compounds, it is likely to cause secondary problems. This is a range from of sensitivity to a full-blown immune reaction. There is a difference in the mechanisms and methods of these reactions, and so sulfite reactions are not the same as sulfate or sulphur allergies. The general and more specific mechanisms by which the reactions can occur in a human is unknown, but by virtue of using clinical data and examining the conditions under which reactions do occur, it has been established that the different reactions have their own unique pathways and mechanisms. However, some have been elucidated. Sulfur dioxide gas is known to be an irritant and causes a reflex contraction of the airways when it is inhaled. Some people with asthma can react to sulfites due to a partial deficiency of an enzyme that sulfite oxidases use. And some people, though there are very few, can have skin allergies. And this is specifically to sulfites, and it indicates a particular immunological response. There are a number of very common sources for sulfites, sulfates, and sulfur. These include drinks such as cordial and fruit juice, liquids such as commercial preparations of lemon juice, commercial foods such as dried potatoes, fruit, particularly dried apricots, and grapes. Some salads, particularly those found in restaurants, as they have sulfites added to preserve the colour, crustaceans, as sulfur powder is sometimes added over the top of them to stop them from discolouring, to particular meat, and this is especially true for minced meats, where sulfites are added, and normally illegally. Gelatin, and then there is some in medicines such as antibiotics. The names that are particularly known for this: sulfur methoxazole, which is used in combination with trimethoprim and is available as Bactrim and other similar names. Less commonly found include sulfazidine tablets, or as an injection or cream, and sulfadoxine, which is used for malaria. And the last type that is particularly well known is sulfasalazine, and this is used as an anti-inflammatory agent for bowel disease or arthritis. There's a long list of possible code numbers in which you could find sulfur listed as in the ingredients for food. This ranges generally between the range of 220 to 228. There have been studies to try and understand just how it works and why there are allergies in humans. One study concluded that a supplementation of 2.6 grams a day for 30 days may be efficacious in reducing symptoms associated with respiratory diseases, and that there were few side effects associated with this. On the other hand, it is recognized that there are sulfur allergies. However, the terminology is imprecise and misleading, and there is a strong movement to discourage its use. There is a push for a distinction between the role of antimicrobial sulfurs, non-antimicrobial sulfurs, sulfonamides, and sulfones, with regards to its role in allergies and other adverse drug reactions. The most likely candidate being sulfonyl aryl amines. These result from multifactorial immunological and toxic metabolic mechanisms, but there is less known about the precise ways that this occurs for other sulfur-containing drugs. Then, there are other studies again that show the majority of patients with positive reactions to sodium metabisulphite are also positive to sodium sulfite, these two being a fairly common substitute for each other in home brewing, and therefore relevant to the home brewer. To summarize the key points for sulfite allergies, there are two studies, one by Valley et al. In 2009, which, to quote, "Most studies report a 3 to 10% prevalence of sulfite sensitivity amongst asthmatic subjects following ingestion of these additives. The severity of these reactions varies, and steroid-dependent asthmatics, those with marked airway hyperresponsiveness, and children with chronic asthma appear to be at greater risk in addition to episodic and acute symptoms. Sulfites may also contribute to chronic skin and respiratory symptoms, end quote. Or another study by Farm and Farm in 2006, beginning quote, inpatient and outpatient use of potentially cross-reactive drugs was observed in 52% of patients. Though numerous patients were unable to give an accurate allergy history, no adverse effects were reported or documented with outpatient or inpatient sulfonamide non-antibiotic use, even among patients with histories of life-threatening reactions to sulfonamides, end quote. Hopefully this has helped to understand why sulfur, and particularly metabisulphites, should be examined with great care when they're being used, and why, when they are being used in one role, they're not necessarily a concern in the other. Thank you for watching. Please post any comments, questions, or suggestions you may have below.